Welcome. Today in this first video, we're exploring how all healthcare professionals can make a big difference in the lives of pregnant patients with substance use disorder by reducing stigma and offering compassionate care. Whether you are office staff, clinicians, or hospital executives, everyone has a role in supporting patients. This video can help us understand and recognize how stigma affects the care we provide. Every day, healthcare professionals are essential in supporting the health and well-being of pregnant patients. For those experiencing substance use disorder or SUD, this support can be life-changing. Yet too often, pregnant patients face stigma and judgment that can prevent them from getting the care they need. Many times we have biases toward these patients without realizing it. This stigma can be unintentionally communicated to our patients because we aren't always aware when we show it. One mother described feeling judged by healthcare professionals, saying,
"I take Suboxone, and, I didn't want to tell my OB/GYN about it at first because I knew he would treat me different. And now that they know that I am an addict, they totally treat me different. Like anytime I have a concern or I want to talk to them about anything, it's just so judgy. And it makes me feel dirty."
Substance use disorder is a medical condition where people continue using harmful substances due to changes in the brain's reward system. This makes it hard for people to quit or reduce their use without help. Viewing SUD as a moral failing leads to blame and stigma. Recognizing it as a medical condition is crucial for reducing stigma. Stigma can cause shame, deter care seeking, reduce substance use disclosure, and worsen health outcomes. For pregnant patients, this may lead to inadequate care for themselves and their babies, including missed screenings for conditions like HIV, hepatitis, and mental health issues. One study found that women reporting substance use were nearly 3 times less likely to receive adequate prenatal care compared to those who did not, even after adjusting for demographics. One mother who experienced SUD describes how fear of stigma led her to avoid seeking any medical care.
"I try to avoid them. I try not to have to go. And there's probably times that I should have gotten medical attention, but just dealt with whatever was wrong at home."
Stigma affects pregnant patients with SUD more than those who are not pregnant. They often hide their substance use due to disapproval and consequences like losing parental rights. Concerns about addiction treatment leading to child removal and negative views on breastfeeding while on opioid use disorder medications further discourage seeking help. As healthcare professionals, our role is to provide patient-centered care which respects and responds to our patients' preferences, needs, and values. This involves building a trusting partnership with our patients by creating a safe and welcoming environment. The words we use matter. Using first-person, non-judgmental, and medically accurate language helps patients feel valued and respected. For example, instead of saying addict, say person with a substance use disorder. Avoid judgmental words like clean or dirty. Use terms like in recovery or navigating mental health difficulties. As a healthcare professional, you can make a commitment to keep learning and reflecting on your own practice. Take part in training on substance use disorders and trauma-informed care. Think about your own attitudes and biases and ask for feedback from colleagues to help you improve. This ongoing effort helps us give the best possible to our patients. By reducing stigma and offering compassionate, non-judgmental care, we can all make a big difference in the lives of pregnant patients with SUD. We can help every patient feel supported, respected, and empowered to achieve the best possible health outcomes for themselves and their babies by talking about SUD at every visit in a caring and compassionate way, using non-judgmental language, connecting patients with resources, and making a commitment to keep learning and improving. One way to build trust is to talk about substance use as a routine part of comprehensive prenatal care. In part 2 of this video, we will introduce an evidence-informed best practice model known as screening, brief intervention and referral to treatment, or SBIRT, that starts with screening as part of routine care. For more resources and information, visit www.carna.com or www.cdc.gov.